Medical Reserve Corps is a force of volunteers who stand ready to support the community in case of a public health emergency. Our volunteers are committed to having a healthy community and being prepared.
For me, it's all about you help your community, your neighborhood, and the world. It's all about helping others and being able to help them with the skills that you learn.
The need for Medical Reserve Corps became apparent after the 9/11 terrorist attacks, when thousands of medical and public health professionals who were eager to volunteer were turned away. The Henrico and Chickahominy Medical Reserve Corps unit has over 300 volunteers, and we're still growing each day.
The Medical Reserve Corps is sometimes focused on emergency preparedness and response, but is also focused on improving health outcomes. So they might go out with us into the community and provide chronic disease prevention information. It's a health department function that the Medical Reserve Corps supplements. One of the main things that we do is flu vaccinations during flu season. So we'll ask our volunteers to come provide vaccinations, those who can, who are licensed to and who have completed the necessary training requirements. But we also need administrative support. This year we've provided 876 vaccinations so far. And we do that by exercising our mass vaccination plan. So we bring people in to what we call points of dispensing and vaccination. And we need volunteers there to help patients register, help them fill out the forms, help move them through the clinic, and then provide any assistance they can, whether it's cultural or language barrier.
For me as a nurse, from a professional standpoint, it's something that I would do as part of being a nurse. Most of my background has been working in hospitals and acute care, but reaching out to the community and getting the community healthy is really where healthcare needs to move, because if the community's healthy, then we have less people in the hospital. It just gives me the opportunity to support my community and to give back as a professional. It's a great way to connect with other healthcare workers and other anybody who's interested in, a healthy community. So it's like a big family.
I have a history with public health nursing. I'm no longer doing that, and this gives me an opportunity to get back involved with the public health and give back to my community. The outreach is incredible. We have opportunity to speak not only about today's focus, flu shots, but also lots of other health resources, diabetes evaluations, giving out insecticides, and just having a presence, making folks aware that resources are available and building relationships in the community.
All kinds of people volunteer. You just have to be 18 or older, and you have to be able to pass a background investigation. You can have a healthcare background. That's certainly helpful, but you don't need to. We can take people from all walks of life, and people from all walks of life do join the Medical Reserve Corps. It's important because as a government agency, we're often asked to do more with less, and we may not have the human power needed to respond to a major public health emergency. So we'll have to tap into the Medical Reserve Corps and really get that expertise and knowledge and experience that already exists in the community and leverage it to help us respond.
I'm able to use my medical background to help at the events. I love helping people. I worked retail pharmacy for 28 years before I became disabled and couldn't work any longer, and I miss being able to work with the public. There's a lot of situations, and we use anybody at the Medical Reserve Corps, not just people with medical backgrounds. If you wanted to volunteer for the Medical Reserve Corps and you didn't have any medical background, that's great. We can use you at the health fairs.
As a member of the Medical Reserve Corps unit, you will become trained to respond to emergencies in your community.
We're starting to move to what we call a population health model, where we're going out into the community more, and instead of relying on people to come into our clinics, we're going out, building these relationships, finding people where they are, finding them where they need the most help, and being there for them. So it is a very active approach. You have the opportunity to change people's lives and make an impact, and you see it. When it happens, you see it on their faces, you hear it in their voices. They're happy that we're there to help them, and we're passionate about doing that. Our Medical Reserve Corps volunteers are passionate about it.
If you're very good with the administration, they can use it with that. Sometimes they might need to update their database. If you're good with Excel or whatever, there is a need there. They can find something for you. I like to talk. I like to engage with people. Public relations, I'm all there. I enjoy that. but I can roll up my sleeves and do something else too.
I'm a retired LPN with some substance abuse counseling. I figured, well, this is a way of me getting out into the community and trying to give back some. I think the most important thing is nothing is too small. You can be the person that picks up the trash can and help dump, or you could be the person who's going to be doing the injections or the flu vaccines or the TB tests. It's not always going to be the major things. It's the minor things that gets the thing going. You don't have to be a medical person. You could be just an everyday Joe who wants to get out and enjoy themselves and meet other people.
They're passionate about helping people and about improving preparedness and resilience in their communities, and also about improving public health outcomes. It's a great way to really make a difference in the community.